If I have a friend, for example, my netball team, and I'm sort of saying, oh, look, I'm not going to get there, list running over. And then they might ask me without any background or knowledge of anaesthesia, then it's a little bit trickier, because then I'm having to explain that anaesthetists are doctors, that anaesthetists have had extensive training, and I'm trying to sort of give them the background of what an anaesthetist does in very, very simple terms. I think all anaesthetists have their little go-to phrases that they use. So when I introduce myself, I always say, my name's Debra Devonshire, I'm going to be your anaesthesia doctor today, because sometimes people don't quite understand that anaesthetists are doctors. And then I will ask them, what they would normally be doing today if they weren't here. I'll ask them some questions. Usually I've done a pretty thorough pre-operative assessment. So usually when they're coming right before the surgery, I'm usually sort of having to try and sort of give a little bit of really light chit-chat sort of to them about the anaesthetist, the team, what I'm going to be doing. And then I'm guided by, if they feel a little bit nervous, then I'm probably more likely to focus on, the safe, sort of warm, comfortable feeling they're going to have with the anaesthetic. So explaining that when they receive the medications, they're going to be very, very relaxed, and they're going to have a very happy sort of experience, that they shouldn't get too used to that, which usually makes them sort of feel a little bit more relaxed, or they'll laugh or something like that. So I usually try and make sure that they feel nice and comfortable and safe when I first see them. And then depending on what sort of questions they ask, then I would go into more detail. They might say, oh, how long am I going to be asleep for? And I'll say, well, it depends on the surgery, depends on how, your body deals with the anaesthesia. And then they might say, well, how does the anaesthetic work? And then I'll usually sort of pitch it sort of to what's something that I think that they could understand. So I'll say, well, it works on the membranes, it works in the brain. It's going to be something that's completely reversible, so you'll go off to sleep with the anaesthetic, and then you're going to wake up. And usually if it's a really short anaesthetic, they're going to feel great, so I'll tell them they're going to feel great. If it's a longer procedure, because I do cardiothoracic anaesthesia, then usually I'll explain that we give them plenty of time to wake up. They're going to wake up nice and slowly in the intensive care unit. They're going to be in the perfect place to manage any issues that they might have. If they have some funny beats in their heart, then we can manage that. If it takes them a little bit longer to wake up, then that's totally fine. We can manage that as well. And that they're in the safest place for the anaesthetic that they're having and the surgery that they're having. I think as a doctor, I decided that I always wanted to feel something. So no matter how difficult it would get, no matter how traumatic the injuries that you would be seeing in patients, I always wanted to make sure that I would always still feel something, because I think it's really easy to desensitise against those things. And I decided that if I ever became one of those really cold, calculating doctors, that it was time to quit. So I think that that's useful, because I think that helps you maintain empathy with the people that you're trying to help them stay healthy. But I also think it's a really tricky sort of skill. So I think over time, so yes, it's a really long process. So there's, medical school, never end, medical school, and then there's junior training, and then there's, getting onto the program, and then there's, doing all of the tough work to qualify as an anaesthetist. And then it still doesn't end, because then you're still developing and learning and growing. But I think during that process, you have certain experiences, and you have mentors, and you have people that you look up to. And I certainly, from a personal level, have chosen them very carefully. And you have this little, I want to be like them sort of moment. And you watch people and you develop your skills around the skills that you think work best with patients. And help them feel comfortable. And it's not just about the technical skills and wow, they did a really slick line, and look at that intubation, and did a fabulous job. You still admire those things, but there's the soft skills around being a professional and looking after people in anaesthesia that you need to develop and grow, and make sure that you maintain your own sense of who you are, and and blend that into how you provide care for patients. So what excites me about anaesthesia is every single day is different and new. So every day that you go into the operating room, you get to hear somebody's story, you get to have this communication with somebody. Our jobs are never boring. So that makes me feel excited about going to work. I'm not saying that some days I'm not, dragging myself out of bed because it's cold and wet and I feel a little bit tired, but overall, every single day is something new and exciting. So it brings you to life when you go to work because you know that you're going to be using your skills to help patients and you feel useful.